Hello, this segment of the SPIVA Toolkit is about focus groups. The SPIVA Toolkit was developed by the San Francisco Bay Area Advanced Practice Center, a partnership between the San Francisco Department of Public Health and the Center for Infectious Diseases and Emergency Readiness, UC Berkeley School of Public Health. Our work is funded by the National Association of County and City Health Officials. The San Francisco Bay Area Advanced Practice Center is part of the network of APCs throughout the United States. The San Francisco Bay Area APC has an expertise in infectious disease emergency preparedness. This APC has developed two toolkits, the Infectious Disease Emergency Response, or IDER Toolkit, and the Seasonal and Pandemic Influenza Vaccination Assessment, SPIVA Toolkit, both available on the website of the San Francisco Bay Area Advanced Practice Center at sfbayapc.org. In this presentation, we'll focus on a segment of the SPIVA Toolkit. The SPIVA Toolkit highlights community assessment as a tool for emergency preparedness. We believe that community assessment methods help inform current and future planning, marketing, and risk communication activities. We suggest that incremental and continual planning be done for more efficient preparedness efforts, and that in using the tools available in the SPIVA Toolkit, they be applied to both seasonal and pandemic influenza, as well as other public health campaigns. Presentation objectives are to discuss focus groups as a viable data collection method in community assessment, to identify how focus groups may be used in planning for seasonal and pandemic influenza campaigns, and to discuss how local health department staff may use focus groups for infectious disease emergency preparedness. The SPIVA Toolkit promotes an incremental approach to assessment. Using key informant interviews, findings of these interviews would then inform the development and design of a protocol for focus groups, and findings from those focus groups would help develop the design and development of community surveys. What is a focus group? It's a group of people gathered to provide input and reaction to planned activities. Local health departments ordinarily plan for seasonal vaccination campaigns, so that's an example of a planned activity. A facilitated discussion that aims to yield information about the perceptions, knowledge, beliefs, attitudes, and language used by service recipients. Local health departments provide the service of education or clinical service such as vaccinations. Mass vaccination campaigns are a service, generally planned, and focus group information, or that which is yielded from a focus group discussion, allows one to refine the planning. Why would we conduct focus groups? Several reasons. To identify a group's level of interest in a topic area, to identify perceptions of a public health intervention, such as a mass vaccination campaign, to identify best means of reaching selected audiences, and to test promotional and educational messages. Focus groups are conducted indoors or outdoors. They may be formal or informal in terms of the tone that's used in conducting a focus group, and the questions that are asked, and the approach that is taken by the moderator. They're a way to create a comfortable and non-threatening atmosphere that's conducive to verbal exchange between the moderator and the participants of the focus groups. Why do we even consider using them as a data collection method in community assessment? Well, let's consider this situation. Low vaccine uptakes in many communities, hard to reach populations in local health department jurisdictions, ambivalent or hostile attitude toward vaccination. Overall, not enough information about communities. If any of these sound like familiar situations in your local health jurisdiction, consider that community assessment via focus groups are a viable solution. For example, amongst local health department practitioners, the word immunization is familiar. But what about people in particular community groups who may be less acquainted with this procedure? Audience testing, a purpose for focus groups. This slide shows a youthful population or community or representatives from amongst the youth in a community. Also, it represents a bit of diversity. Would we test a message amongst the youth? We could do so via a focus group and find out the verbiage, the wording that may be used, the euphemisms that might be available that describe vaccination, the means of how to reach these people, and how best to derive what they tell us to inform the development of a slogan or an educational message. Let's take this slide as an example. We see two sets of hands washing with soap and water. Do we provide a message about hand washing in the same way to two different groups of different backgrounds? We could find that out by running focus groups or conducting focus groups with representatives of one community and another, and determining whether the messages that we consider are going to be heard similarly will indeed be understood, comprehended, or whether there might be some connotations that we don't expect. Special populations, those with particular needs or interests, or a particular age group. We might want to know, how do they hear our message? What do they think about it? And what is their response when we use particular words? We may ask this question, or the same set of questions, with a different group, such as mothers, who are caretakers of another group within our community who may not or who wouldn't be able, because of their age, to provide informed consent. So what do the mothers hear? What do they think? How would they respond to certain key messages that we want to include in our informational or educational campaigns about vaccination? Assessments can provide solutions to the question or to the issues that surround low vaccination rates. They allow us to measure vaccination rates in specific subpopulations, identify how best to communicate this vaccination clinic information to them. They provide insight into methods for reaching at-risk populations, and assessments supply feedback from community members in order to improve planning. Some examples of the use of focus groups for vaccination campaigns are found throughout the country. In Broome County, New York, for example, they've used focus groups moderated by health department staff to inform community surveys on H1N1 that are currently being conducted. The Association of Refugee Health Coordinators, in partnership with CDC, has tested educational messages among particular groups. And the Centers for Disease Control has recently used focus groups to inform the campaign about universal seasonal flu vaccination in 2010 for the entire U.S. population. Focus groups, therefore, are a way to gather input in a small group format and in an interactive setting. They're used to pretest assumptions and ideas, and used to determine key questions for further or in-depth study and analysis. They do need to be planned. And towards that planning, in the SPIVA Toolkit, you'll find descriptions of some of the steps that are required, such as defining the focus group goals, identifying the community that is to be represented by the focus group participants, recruiting focus group participants, what ought to be included in the design of a focus group protocol. Reminder that pilot testing the focus group questions is essential. We suggest or we offer tips on how to conduct successful focus groups to yield the information that is frank, honest, and current for the particular groups represented in your focus groups. And we also describe a bit about how to communicate the findings. The information that is yielded from a focus group is considered qualitative data or qualitative information that has to be either recorded or transcribed and later analyzed and synthesized for presentation as a summary, either in written or electronic format. Overall, in the SPIVA Toolkit, we promote a mixed methods approach in community assessment. Key informant interviews are described in another segment of the SPIVA Toolkit. In this presentation, we highlighted focus groups. But incrementally, key informant interviews and focus groups help inform the development and design of surveys, a method that is used for population data. There are advantages of using focus groups. You have face-to-face time with future consumers or recipients of planned services, such as mass vaccination clinics. They provide a link between the sponsoring organization, local health departments, say, and the program recipients. They offer an opportunity to test assumptions in real time. There are disadvantages of using focus groups as well. They may yield insufficient information for a comprehensive community assessment, requiring then one to design and develop a community-level survey or community-wide survey. The discussion triggers that are used, or the questions that are used, whether they be the open-ended questions that you begin with or the trigger questions that follow, might not be sufficient to yield the data of interest. And you wouldn't know that until you follow up and analyze the data that is obtained from the discussion derived from the focus group. They may require sufficient resources, or they do require sufficient resources for facilitation, site access, and participant incentives. So you have to consider those elements in the budget and preparing and planning to actually have focus groups as part of your data collection method. Facilitating focus groups requires that the moderator, or this may be a local health department staff member or a private vendor that's contracted to conduct the focus groups, have a natural curiosity about the subject of interest, be that the topic or the people that are participants of focus groups. Facilitating focus groups requires familiarity with small group dynamics, because in any group of 2 or more people, there will be undoubtedly activity and occurrences that happen as a result of the personalities that appear or that are part of the focus group participants. Flexibility within our protocol is required. Earlier, I suggested that focus groups could be conducted indoors or outdoors. Imagine having to improvise and find that the site that you identified as your focus group setting is not available, or you find a locked door. Flexibility in trying to find an adequate setting that is also an environment that's conducive to small group discussion and recording of the information that's obtained and the responses that are provided requires some creativity and some flexibility. And listening skills. The facilitator or moderator of a focus group has to be skilled in listening. Some uses of focus groups are to inquire about existing services, about relevance of future services, about how to reach intended audiences, about learning of existing group behavior and practices, and also learning of the popular use of expressions, verbiage, wording, how groups understand and communicate with each other. Perhaps the technical level that we may be accustomed to in research studies or local health department interactions may be inadequate to develop the appropriate and most helpful campaign to promote getting vaccinated. So, takeaways from this presentation. Use focus groups alone or to complement other community assessment methods. Successful focus groups require planning to yield useful data, and community member input and participation is a requisite for successful vaccination campaigns. We've presented an overview of focus groups as a segment of the SPIVA Toolkit. For a complete view of the seasonal and pandemic influenza vaccination SPIVA Toolkit, please visit the website of the San Francisco Bay Area Advanced Practice Center at sfbayapc.org.